Thank you guys so much for being here today for our CardioNerds Book Club to discuss State of the Heart. It's my honor to introduce Dr. Haider Warraich. He's currently a professor at our medical school, and I'll give you a quick introduction about where he's been and where he's going. So graduated from Aga Khan University, and following that, completed his internal medicine training at Beth Israel Deaconess Hospital, followed by cardiology and advanced heart failure training at Duke. As I mentioned, he currently is the director of the heart failure program at the VA Boston Healthcare System, an associate physician at Brigham and Women's Hospital, and an assistant professor at Harvard Medical School. And, in addition to his ample clinical work, he's a prolific writer, published not only in the New York Times, Washington Post, been featured in NPR, interviewed by Terry Gross, very, very illustrious things, but also is the author of 3 books, one of which we have the honor of discussing here today. And I know, Dr. Warraich, when I think I first came across your work reading Modern Death when I was a medicine resident, and just being in the ICUs and just kind of hearing, just changing my approach and changing my thought process to how we think of into life and how we think of how we take care of patients in that setting. And, something I was interested in cardiology, is seeing someone who was, in cardiology training at the time doing this work and writing about this it just blew me away. And then knowing that you had a book in the pipeline about cardiology and the history, and so many of the stories of the history of cardiology, was so excited to read. So thank you so much for joining with us here today, and for spending the time to meet some members of the CardioNerds family and to share your wisdom.
Thank you, Tommy, for the introduction. It's so great to be part of this really great group. I think that once you've written a book on cardiology, I think it's fair to say that you are a bona fide cardiology nerd. So to be at the official platform for other fellow individuals who care so deeply about the heart and who are going to invest their entire careers in it, it's just great to be here. And the honor is really mine.
Thank you so much for spending the time. I think the first question I want to start out with, really just kind of, it's easy to see where you are now, but I would love to just get a sense for, did you always envision this career path as a physician author, and having both these sides of the coin be important to your work? And if so, just how did that come to be when you were in training? And if not, then how did you find this pathway as a physician author?
Yeah, I think that if you look at, I remember reading this call a long time ago in which it presented 2 different types of people. There are people who had this sort of vision for what their life was going to be like. And then once they have that vision, then they kind of work their way backwards from that. And then there are other people who just are very much in the moment and are very much in, thinking about, what is it that I can do now that gives me joy, that I can, contribute to, that I'm good at. And that's the person that I've always been. I've think that I've never had a grand plan, so to speak, even though now that when I look back, it does seem like, oh, this all makes sense. This is why you do this or that, etc. But the way that I've lived my life is that, I just looked at what's ahead of me. What can I do? What can I achieve in the moment? And what gives me joy and pleasure? And what specific skill set do I have? And so instead of having this very formed version of who am I going to be when I grow up, or, what is my career going to look like, I've always been very much in the moment, and therefore very ready to pivot as opportunities change, as circumstances change. And I feel like that's how I would approach writing as well. When I first started writing, I was writing fiction that had nothing to do with medicine. And it was in no way, if anything, it was drawing me away from my career, because I felt like, I have this great passion for storytelling and writing that is completely at odds with what I was doing. And it was only when I started bringing those 2 together, my professional life as a medical student, as a physician, as a researcher, and my passion for writing and storytelling. And when I brought those 2 things together, then I really felt like a homogenous person. Then I felt like a whole person rather than one that's fractured in different pieces. And so that is that is what started to lay the foundation. And when you think about writing a book, you always have to start. You have to go all the way back. It's the same thing as running a marathon or writing a grant. You don't run the marathon at your first go. You start running. You have this passion and love for it, and really you work on that on yourself, get stronger. and train until you feel like you're ready for that big marathon. And that's how I approached writing. My initial work was just short essays that I would write that, based on encounters that I'd had or ideas that I had or stories that I wanted to tell. And then it came to a point where I just had so many of those stories, and I feel like what I wanted to say could not be contained with any book. And that's how really the writing led to the book eventually.
Fantastic. And I think that's something that a lot of us feel is, this wanting to have these different parts of ourselves represented in our work and feeling that we're not whole until we find that. But then when we find that way where we can have that synergy or the creative pursuits as well as the caregiving pursuits, the healing pursuits, and all these things can intermesh and intertwine. That synergy is so powerful. And it sounds like just being able to match those things has been really impactful for you, and then being able to find a way to express that in the way of a book was really a big step forward with that as well. When you so when you first published, was the first book, was it when you were a cardiology fellow when the first book came out, correct?
Yes, yeah, I wrote the book as my final year of residency, and then I had a few months as a hospitalist, and that's when I really wrote the book. But it was published after I was a first year fellow when I published Modern Death.
Excellent. And what was just that experience like in terms of balancing clinical work? You were a first year hospitalist, and then you were a first year fellow, and all this learning in terms of these new clinical roles, while also, I imagine, being in a whole new role of like publishing and being inside that world. What was that like in terms of creating something as tangible as a book while also being so engrossed in your own medical training?
Yeah, I mean, and now that I look back, it feels it almost feels hard to believe that I didn't. I think it all comes from passion and love. When I was I'll give you a small example. I mean, I was working harder than I'd ever worked before. I mean, I was writing, I had written the book before I'd started fellowship, but I still had to edit it. I still had to work on it. And in some ways it was similar to, how people balance very productive research careers. I mean, there are so many people who are doing so many amazing things in research. There are people who are developing amazing podcasts and curriculums, and the people that we have co-fellows who were getting grants to run clinical trials. I mean, it is all about organizing your time and just being extremely efficient and not letting any opportunity go by. I mean, I think that that's one of the things that I always say for people in medicine who want to write is that you're never going to get that perfect moment. Right? You're never going to get that. You're never going to get those 6 months in the south of France where you can just, lounge and just write the next great American novel. I mean, you're going to be post call. It's going to be on weekends. It's going to be nights. You're going to be tired. There's going to be competing opportunities. And so I really kept things very simple. I mean, when I was writing the book, it was basically writing and clinical work and learning and training. And there's very little other distraction. And I was very lucky. I had a very supportive spouse. I had a very supportive family. At that point, I didn't have kids. So it really was just me just being laser focused on the most essential things. I mean, in the end, the core thing, the chief thing that I wanted to do was that I wanted to be a cardiologist. And if anything, I think the writing put even more pressure on me because I never wanted to give this impression that I was not present, that I was not as fully committed to my work as a cardiology fellow as anyone else. And so I put myself under even more pressure than someone else would be, because I was always concerned that someone might feel like, oh, is this guy really what's their deal? Or do they care about being a fellow? Do they care about learning cardiology? And so I think it really brought the best out of me, just putting myself under that type of pressure. Writing brings its own forms of pressure. You know that everything that you write is going to be read, and it's going to be read sometimes years after you've written it. It's going to be read by your patients, by your family members, by colleagues, by people you look up to, etc. And so, I think that that's one of the cool things about cardiology is that I think that a lot of people join cardiology because they love the intensity. They feel like the intensity of their work brings out the best in them. And they want then that our preparation, our training is for those moments. Is that when things are most intense, are you ready to do the best for your patient? Are you ready to do the best for your teammates? And I feel like that type of approach has helped me um, both in training, but also as a writer.
No, that's excellent. And I think that segues nicely into just when you're thinking about what you're choosing to write about. And I'll ask, after you published Modern Death and you were, as you said, you were a cardiology fellow in training, what was it when you were deciding, okay, what do I want my next book to be about? What was it that led you to State of the Heart and you're writing a book about cardiology in of itself and the stories that kind of make up modern cardiovascular practice?
Yeah. I mean, in the end, I have always written about what you know, what you live, and what you love. And, as an internal medicine resident, that was my first exposure to how we treat people at the end of life. I had done my medical school training at Afghan University in Pakistan. And so the way that we treated people at the end of life, there was very different from how people are treated at the end of life in the United States and in other modern countries. And so that to me was the biggest sort of, it was something that or really sort of engrossed me. It stimulated me emotionally, intellectually. And I really just wanted to understand, well, what were the things that brought us to this moment? Um, and then when I wrote State of the Heart, it was similar, but it was about cardiology. It was about thinking about, well, when did we decide that, randomized trials were the best way to learn about heart disease? When did we decide what is the history of, how do we decide that LVADs were the way to go for mechanical support? Why not BiVADs? What was the journey for this technology? What was the journey of something like transplantation? But also I was just surrounded by all these people, these men and women and some children who had heart disease, and they had these stories that I was completely enmeshed in. And I felt that, one of the reasons why I love cardiology and why I wanted to be a cardiologist was that I did feel that the story of cardiology was just not being told in the mainstream the same way as we hear about other conditions like cancer, like HIV, for example. And in some ways, I think public at large has decided that cardiovascular disease is something that's been fixed, that's been solved, and it's not something that ails people. And I wanted to bridge that gap. I really wanted to feel like I really wanted to be, one of those voices that is going to be able to tell those stories of people with critical cardiac disease, but also, just plain things like, high blood pressure. So that's why I wrote about heart disease, because I felt like I was so in that moment, and I was surrounded by all these stories that I felt that needed to be told, that needed to be put out there into for the outside world. And they weren't, for all of us who are here, um, the reason we all love cardiology is because of those stories in the end, right? And in the end, when you go back and think about your fellowship or you think about your residency and when you write your personal statement, I know it's a cliche, but it always starts with the patient. And I feel like that book provided me that opportunity to both process fellowship, but also really sort of set a platform for exposing others to what made me love cardiology so much.
Oh, that's fantastic. And I was going to quote something from the book that I thought was really interesting. This is at the end of your chapter talking about, how cancer and relating how we process cancer diagnoses and how we process cardiac diagnoses, and this idea that in order to increase the not only awareness, and awareness really isn't the right word, but maybe the understanding of cardiac disease amongst the general public. It's and you say the answer is to tell heart disease's story and heart disease's language using heart disease metaphors. And I found that, metaphor in medicine, I mean, this is, going back to Susan Sontag, this is something that this idea of illness is its metaphor. It's something that I think physician writers go back to as well. And I love this idea of defining, well, what are the poignant metaphors of cardiology that both help us find meaning in our work, but also bridge the gap when we were talking to others, patients and families about their disease. So I found that really poignant when I was going through the book. What do you feel like are the heart disease metaphors? What does that phrase mean to you?
Well, there's so many times. I mean, I feel like, you know, um, our language and our culture has become, saturated with medical terms that go beyond just medicine. And I still, oftentimes, when we talk about, a an enemy, that enemy is destroyed, and evil ideology, it's often described as a cancer, and when it spreads, it's sent to metastasize. Um, and it's a powerful analogy because it evokes this emotional response, and it's so visually striking, even though we never even seen metastases most of the times. Um, and my own sense was that in many ways, the language that we use in cardiology was actually working against us. I mean, we've all talked about this idea of, I mean, I think that the first, these metaphors around, these plumbing metaphors around coronary disease, if anything, instead of highlighting the problem, they almost minimize it. They take something that's so complex as atherosclerotic heart disease and just make it all about, open and blocked pipes. And that type of language was affecting how I think patients thought about it. I think many patients, I still feel like, when they come with heart failure, they feel like, oh, I'm here for a tune-up. Well, not really, right? I mean, it's a bit more than that. And so I feel like in some ways, the metaphors and the words and the language that has flourished around heart disease, in part because of our success, right? We have changed the nature of, myocardial infarctions over the last 50, 60 years. We've changed what shock looks like. We've changed what heart failure looks like. The reason and yet I feel like but at the same time that the words and the language and the culture that we developed around heart disease is always feels outdated. It almost feels like now it's working against us. And I think that that's really why I wanted to really revisit some of these sort of initial ideas and challenge them and think about, well, how can we do better? Like, how can we do better in describing or developing language or developing metaphors that can better translate what we know and see as cardiologists into what people feel and understand as patients.
No, I think that's incredibly important. Just, I think we've all had experiences where we've told a patient that they have heart failure or they're in heart failure, and maybe the first time they've heard that word heart failure and the weight that that word carries, versus, oh, I know I have a heart issue, but I know that my heart is failing or it's failed. Versus, the word of a heart attack, I think something that really carries a lot of weight. And what that means in the modern medical world of STEMIs and NSTEMIs and unstable angina, and as that term continue to define, I think, I think it becomes more and more challenging and more important that the words we use to communicate with patients are thoughtful. Um, to go off of that, I think, when you in your books are really written towards oh, actually, I won't put words in your mouth. I'll ask you, when you write your book, who is the audience that you really envision? Is it a group like us, cardiologists, cardiology fellows, people who like are interested in the history of this? Is it the patient who sees it on the shelf at Barnes and Nobles, who knows a family member who has heart disease? Is it a bit of both? Is it a bit of neither? Who do you think, when you think of, who do you think of when you write?
Well, well, I, you know, it's hard for me to ever know what other people want. But what I know best is what I want to know, and how, and what excites me and what interests me. So, when I write, I try, and I feel like when I read, I want to read stuff that isn't dumbing things down, but is also explaining them in a way that helps me understand. I feel like I don't shun details just because I want to uh, sort of mass complexity. If anything, I feel like we need to embrace complexity more. And so when I write, I mean, it's the first reader is me. So I'm thinking about, well, what am I writing that I would be excited to read about? And that would be, I would want to see science. I would want to see stories. I would want to see, citations, right? I would want to know that does this person actually, I mean, is this just a statement? Is this an opinion, or is what is the background of this statement? So I start with, what excites me, and then, the nice thing about the publishing process is that, a lot of times our writing is very solitary, but publishing can be fairly communal in a way, because, when I write something, I mean, you have you have an agent who reads it, you have editors who will read the book, they decide whether they're excited about the book as well. Then you both sort of work together, and that relationship can really define where the book goes. Um, and, but I'm always, but in the end, I'm always thinking about, well, what am I most excited about as a first draft, right? As a first draft, that's all I'm thinking about. And then when you're working on editing, then you're thinking about, okay, do other people really care about this, right? I mean, there's so much you write, that never ends up on the final page because you are the only person who cared about that, right? When the editor read it or someone else read it, they're like, this doesn't make sense. And, there's famous, saying in writing is, is to kill your darlings. And to be prepared for that. I mean, and I think that that's um, part of writing is that in the end, it is a communal activity. I mean, if you're just I'm not writing only for myself. I wrote the book, and now you all have read the book. And so now we're all just shared, and we've all probably taken different things from the book, right? I mean, and so I start off with thinking about, well, what is going to get me super excited? And what I love is I love science, I love stories, um, and then as I work through the book, then I'm thinking more about making it accessible, making sure that the stuff that I'm super excited about, am I successfully conveying it? Because if I'm not, then either I need to rework it or I need to just get rid of it. So that's my approach. I mean, I think that I'd like the book to be accessible to, I would like physicians, even cardiologists to read it and find it interesting. I would want patients and their caregivers to read the book and find it accessible, and to provide them a sense of this idea that they're not the only ones who are in this predicament, and that what they're experiencing today is actually the work of hundreds of thousands of years of scientific progress, so that they can sort of see themselves in time rather than just as as isolated beings. So yeah, so I do think about the audience, but I will say that it's usually at the second half of when I'm really editing the book, because that's when I have the audience more in mind. Initially, the first draft is just from what, because if it isn't exciting me, if I'm not excited about it, I'm not going to be able to write it.
No, I think that makes sense. And I think that ties back to why a lot of us have a passion for writing, is that we are excited by something and we're just trying to get our ideas out onto the page. That cathartic process, I think, is what drives us and drives a lot of the work that gets put out there. And I think, just to your point too about, a lot of people in our academy really, what we really try to teach is how to be an educator, right? And so that's not only to how to be an educator for the other cardiovascular community, which includes like medical residents, fellows, staff, whomever, but also sometimes it's how to teach to a patient, right? And I think that's some different skill sets. Always coming at it from a place like, well, what am I interested in, and what am I going to be driven by and passionate by to teach? I think that probably correlates there as well too. What am I driven by and passionate about to write? I'll take a moment. I feel like I've talked a lot. Chelsea had actually brought up an interesting question in our conversation earlier. I'll give her an opportunity to ask it.
Okay. Hello, Dr. Jared. So one of my questions, I think what I really liked about the book is how you were able to relate life events to how that affected the care and management of heart disease. And I saw that it was published in 2019. And as I was reading, I was like, I wonder what this book would be like if it was published post-COVID pandemic or post-world events that have happened since the book was written. So I was curious, how do you think the book would have changed if it was written now, and what things you would add or what things you really would you take out if you were to write that book again?
Yeah. Oh, well, that's a great question. I think that at least the pandemic itself would have impacted my ability to write this book, in part because, you know, I think the social distance, I mean, I've never, I still remember my first few times when we were rounding during the pandemic. And it was the first time that I was ever afraid to go in a patient's room. I was afraid to hold their hand. I was afraid to hunt them. I was afraid to stay in the room longer than I needed to be. And I'd never had that feeling before. I had lived for the moments to be with patients, both for, you know, important conversations, for make a diagnosis, or to, provide, emergent critical care. And the pandemic really just, it for the first time, I felt like I had, I hesitated before I go. And I feel like that would have affected my ability to have really been able to write this book the way I would want to do it. I think it would have affected some of my, experiences. But but I think that what we've seen with the pandemic is that even throughout the pandemic, heart disease has been the number one cause of death in this country. So even with a historic pandemic, more people still die of heart disease than ever before. And I think that the few things that I would focus on probably more today than I would have before, I would probably focus on trust more. I mean, I wrote about misinformation before the pandemic. I've written about it actually a bunch of times. Because I grew up in a place where there was a lot of hesitancy about vaccination, polio vaccination specifically. And then I wrote about statins and how people have these warped ideas about statins, how that's affecting actual people. In fact, I still remember patient story that I shared, and I feel like I would put more work in that. I would put more work in thinking about how do we overcome this? How do we establish greater trust between patients and physicians? And part of what I wanted to do with writing about research and trials was that I wanted to sort of, I wanted to, the chapter is called How the Sausage Gets Made. And the reason was to make it more transparent to people about what is the process, like what does it take for that stent to get into your body? What does it take for this medication to be developed, be tested, and then reach your, and reach it and get to a point where it's now being prescribed to billions of people. And I wanted to tell the stories of the people who were involved in those discoveries to really sort of show and get people fascinated and interested about science. But I would think more about that today, because I think what we've seen is is that the pandemic showed how much, how there is a gap. But there's much about the book that I feel like I'm sorry, that those things are still quite relevant. I ended the book by thinking about, well, what is going to be the big thing that we all have to think about in cardiovascular disease? And I came on this idea that in cardiovascular disease is different because the next big thing in heart disease is already here. How are we going to get it to people? How are we going to get it to make sure that everyone who has heart disease gets the stuff that we already know works, rather than the sort of futures or things that are still there? And I think that problem remains to this day. I think I was and still remain very passionate about how can we provide better end of life care for patients with heart disease. And unfortunately, and the data supports it, we've not made a lot of progress since 2019. So I do think that the book would be different in some ways. But there's always room for it. I mean, that's one of the beauties about medicine, is that, the stories all of us are exposed to these stories that are so evocative that if you tell someone, they won't think it's science fiction. Even the normal working days are so unique, not just the specials or stories, but even the day-to-day work that we do. And so I think all of us have stories to tell. And I certainly feel like this is that I can't wait for the next, big book on heart disease, because I do think that there's so much more that's left unsaid. And that I think that our field is going to do better when we're able to get those stories out there.
Thank you.
Excellent so much. And I love the idea of the mundane story is just like, a patient in clinic with hypertension and trying to think of how you work that up and pair next to the story of like the development of balloon angioplasty and a larger than life character like Grunsdick. I think having those people have equal stake in the book, I think really speaks to what it's like to be part of this field. I'm going to throw to Christian. We had a nice, great question in the chat as well.
Yeah, thank you so much for speaking with us all. This is awesome. My question was, as I was reading the book, I was struck by so many, like all your very kind of detailed and sometimes esoteric facts about kind of human nature, almost like why folks wear the rings on their fourth finger and how that relates to like cardiovascular history. And I was just curious how you encountered that information in the first place. And kind of like what kind of work you did to collect all those little bits of information that make your writing so rich.
Well, thank you, Christian. I think that, when people talk about writing and they say, we talk a lot about, well, how do you write? And I think that the key thing there is the writing represents maybe about 15-20% of the time that I'll spend. The rest is all done in research. And the rest is all done in reading and then having a system for really just casting a wide net that spans history, literature, science, and then sort of having a filing cabinet in your head, but also a literal filing cabinet. I mean, I have a sort of color coding system for reading papers. I take a lot of notes. I build very detailed outlines, and I keep adding, tidbits in it. Sometimes it's too much, and that's where, the editing comes in, and you sort of have to pare back and really get to sort of the heart of it. But we live in this golden age where all the knowledge in the universe is all available to all of us, right? I mean, any of us can go and read a copy of the New York Times from the 1890s. And that's, anyone who has a university subscription or is part of the university. I mean, I know this because I've worked in academic centers, but my guess is that this information is available to others as well who don't have a .edu email address. But there's so much stuff that's available to us. And when it comes down to is, what are you not going to include? And what are the things that are going to distract from the story rather than add to it? How are you going to stay focused on an idea and build it without someone feeling like, oh, this is too much. This is a lot of information that I just can't hold it together. I mean, for me, one of the goals of a book is that you want to write a book that people are going to finish, right? You want a book that's readable. That's the first job of the book, right? The first job of the book, before we talk about all these sort of, esoteric sort of purposes, whatever, etc. A book is meant to be read, so it has to be readable. And that's why I think stories help you read a book, because that, and then some interesting facts, and maybe some humor, and maybe some fact, but then in the end, it all comes down to storytelling and structure, and just finding a balance between what is too sparse and what is too much. And the book reflects how I've thought. When I sort of approach a subject like heart disease, it's not just about the heart. It's really thinking about how is the heart affected by all of human society, all these technological advances. So that maybe can we reach a new understanding. So I think early in your career, I think research is really important. I mean, if I was, for example, when I wrote the book, I was a cardiology fellow. Right. I mean, so almost everyone who around me knew more about cardiology than I did. So the only way that I could overcome that was by really, really committing myself to the research, by committing myself to the fact that I need to be able to, this needs to stand up in front of you, but this will, Eugene Baumol is going to read this book, and he's lived through all of this stuff. And it has to be for everyone. And which is why I think when I do, I still remember when I first met Dr. Brunwald, and he had read an earlier version of the book. I interviewed him for the book along with others. And he, told me it was the best book on heart disease he had read. And I literally just cried because I think coming from someone like him, it meant so much, but I feel like it has to translate, it has to affect, you can't just write for the grades. You have to write it for the patients. You have to write it for that patient in clinic with a blood pressure of 145, right? As much for the pulse patient in the CT. Just finding a balance of what is going to keep the reader going, right? And finding the stories, the pieces of information, and the words that are just going to move one person from one page to another. That's the goal. And for me, the way to sort of make that happen was expose people to a lot of fun science and information, but do it in a way that'll keep them going.
That's excellent. And I think also, I feel like I would just want to just encapsulate the moment with Dr. Brunwald. It's like, this is the best that I've seen. It's like, oh, that's pretty great right there. But that's excellent. I'm going to throw it to Shivani, who I think had a question as well.
Yeah, thank you so much. I have really enjoyed reading this book. One thing that I found interesting was at every step of the way, when people figured out how the heart actually worked or what the pathophys was of atherosclerosis, they were always met with a lot of resistance because it challenged what was known at the time. And I know you mentioned with the plumbing hypothesis, we're all very comfortable with what we've learned in medical school currently. What's your advice for how to be confident in what we know, but appropriately critical and open to new information? Things challenge what we think we know right now.
Yeah, I mean, I think that's a phenomenal question. And I think that, one way to think about this is that, people say this about medical school, but I think it would probably be fair about this book is that half of what we know in this book is false. We just don't know which half it is, right? And it's going to be false. And I think that humility goes a long way. I think humility and open-mindedness and curiosity goes a long way. Certainly, you want to have a strong foundation. You can't be a crypto bro thinking about mRNA vaccines, right? I mean, you need to have a strong foundation. You need to have the basics right. And I think that foundation can set you up to really sort of, question, what are the unanswered questions, or what are the sort of unknowns, and how do we, and I think that when I looked up to people I look up to, they were so nimble. They were so ready. I mean, I remember this one interventional attending who was at the peak of his career. He was one of the most skilled interventional cardiologists of his time. And this is around the time that radial artery catheterization really came to fore. And he was, at least to, of the people that I knew, one of the only people of that generation who completely switched his skill set, who went from being the very best at something to being completely average, right? And I want to be that guy. I want to be that guy. I feel like if we are too wedded to our ideas, if we are too wedded to dogma, then we're gonna miss some really, really important things. But I think that the way to do that is by having a strong foundation of knowledge and of knowing what we know. But yeah, I think that's always hard. I mean, I think that medicine moves slowly, and it does, and part of it is justified, right? Because what we're doing is so important, it affects so many people that you don't want to be, you don't want to live in a world that is more like the tech world where, advances are happening and no one's thinking about what those mean, right? It's fine to be slow. It's fine to be careful. It's fine for dogma to not be wiped out in a moment, because I think that what that suggests is that maybe you don't have the safeguards in place. And so I do think that I do think that humility, open-mindedness, flexibility are important. But I think that once you have a solid base of knowledge, I, I think making sure that you're always ready for new experiences, making sure you're always flexible, making sure um, you never fear being outside your safe environment is, I think, the key to being able to see those truths that are out there, and being able to change how people think.
Awesome. Thank you.
That's excellent. I'm going to throw it to Adriana for another question.
Thank you, Dr. Warraich. It's been a wonderful discussion and getting to meet you virtually. My questions are more on a different side of things that people have already mentioned, primarily because in medical school we are never taught about how to publish a book, especially one in which you're like practicing or like the art of storytelling. And so my questions are mainly on like, could you walk through us on the steps of publishing a book and also some of the challenges, for example, like having to choose a publisher. I know for your books, you changed like different publishers. And so I was wondering what, like how you went through
Yeah.
that process of choosing one, and also like what were your most rewarding moments and anything you would have done differently.
Well, I think that's an excellent question, and I do agree that it is kind of a black box where I think a lot of people obviously read medical literature. I think a lot of people read essays, but we don't. But a lot of places don't have the structured mentorship, and I think part of it has to do with a lot of writers end up being kind of, they're like introverts, and they didn't have mentors either. So everyone's been kind of so many people have been doing it on their own in a way, that they uh, but I think that there is a way to overcome that. And one is that I do think that now there's a much sort of more rich environment of, there's so many people who are writing and communicating in so many different platforms, whether that's podcasts, whether it's storytelling, whether that's essays, whether that's books. And so I think the first thing is identifying, well, what is your medium or what is your goal? And, like I said, there's very few people who, the first time they wrote something big was a book. Um, I mean, if you look at different models, if you look at, for example, Atul Gawande wrote for Slate for years and years and years, right? For example, he wrote so much, and then only after a while did he then start writing longer form books, and then he started writing Harper, and then everything went on from there. And so I think so I always I think exercise analogies are more great for books. I mean, if you're going to run a marathon, you need to stay in shape, right? And the way to stay in shape if you're going to write a book is that you need to be writing. You need to be writing a lot. And the first reason to write is to get rid of the bad ideas, right? I think that the first thing that you have to do is that my own, this is just me, but I think that it does resonate with other people, is that your first few ideas are always going to be, the Simpsons did it, right? Or someone else wrote about it, right? Or they are going to be superficial unless you're gifted, because the way that they get exposed to medicine initially is very superficially. I think, and then you get deeper and deeper as an intern and as a resident and so on and so forth, where then you're really inside it, you're in it. And then you really, then that was when I didn't really understand medicine until I was a resident. I'll just say that. And I didn't feel like a physician. I didn't feel like a doctor. I felt very much like I'm on the outside. So I think that exposure experience is important. And when it comes to you, you'll see it. But the way to write a book is, first you just write a lot, because I think that, and it doesn't all have to get published. That's the other thing. Just be very comfortable with rejection. I get rejected so much today, to this day, that it's unbelievable. You have to have a very, very, very thick skin. Yeah, I mean, it's just that this space for the sort of writing that I think we aspire to is really shrinking. And part of that is because of the economy of writing. The economy of writing is all about attention. So, unless you want to write about something that is, very attention grabbing, right? Or very, of the moment, then the space for writing that has more shelf life that is getting smaller and smaller. So I think so. So the first step to writing a book is write a lot, be prepared for rejection, and then I think it helps if you published in reputable places. And the reason it helps is because it gives you credibility. It makes sure that at least that people at least read your email. But once you reach a point where you feel like you can write a book, the first thing you do is you write a book proposal, which is kind of this long summary which is several thousand words with some sample chapters and really very detailed, rich outline of the book. And then you find an agent. At least I found an agent, and most people still work with agents. And then the agent will take the book and they'll identify, well, who could be good publishers or who could be publishers interested in this type of work. And then they will distribute the proposal across these different editors and these different publishing houses. Everyone is very specialized. So the agent that I work with specializes in literary nonfiction. And all the editors he knows are in literary nonfiction. And so once all the publishers read the proposal, the editors then will take that proposal and if they feel strongly about it, will pitch it to their entire team. So they will try and sell the idea of your book to the rest of your team. And if the team agrees, then they will make you an offer. And then they'll say, but before that, they may want to talk to you. They may say, oh, I'd love to talk to, this gal or this guy, and just to see what are they really about? Like, they want to know you as a person beyond just what's on the paper. Are you someone who feels passionate about this art? Can you communicate these ideas in a way that can grab people's attention? And so once that conversation happens and you get an offer, if you have multiple offers, then your agent can negotiate with them. And then based on two things. One is the offer itself, but also the fit with the editor. Those are the two things that are most important. And then you sign the book and they tell you, well, we want to first draft in 2 years or a year and a half. And so that you basically get to work and work. I didn't know a lot about this before I wrote my first book. When I wrote my first book, Modern Death, I didn't know about writing a proposal. I just wrote the whole book. And I shared that with an agent, but then the agent made me write a proposal, which was then I shared with publishers, because no publisher, no editor is going to read the whole manuscript, and pitch that to the rest. So that's in a nutshell. I think that's at least been my experience. But people have taken different paths, and I think that if you have an idea and the moment is right, and if you find the right editor, all the rules don't matter, right? I mean, these are all just my own personal experiences, but I think that there's so many different ways that you could go about it, based on the idea, based on how resonant it is. I mean, I've written a book proposal my first 3 proposals were all I got, I wrote them, got multiple offers, done, right? It was easy. And then I wrote a proposal that was completely shit out. So, and the reason I share that is because I think people don't talk about that stuff enough. I think that, but I think it's important. It's important in every aspect of what we do. It's important when you're doing CPR is to know that you can't control the outcome. You can control the process. And did you do your best? Did I do my best? And the same thing is true with writing. That did I do my best? And the outcome is sometimes outside of it.
That's very helpful. Thank you for sharing all of that.
Sure.
Thank you so much, Dr. Warraich, for all your insight on your advice and just thoughts on this process and kind of your experience with writing and experience in cardiology and how the two have kind of formed the other. We're about at the hour, so I do want to be respectful of everyone's time. I had one last question, and I think maybe we can address it quickly. But I would just want to hear, we've talked a lot about how your practice as a cardiologist informed your writing and your practice as a physician. But I would just be curious to hear, how has your practice as a writer informed your work as a physician, as a cardiologist. How does that street flow both ways?
Yeah. I think being a writer has made me very curious. I'm always trying to, I feel like, I feel like I listen more intently. I pay more attention. Not everything that you encounter as a physician is going to end up in a story. In fact, probably like, a small, minuscule percentage of what we've experienced is ever going to be told to anyone else in sort of this way. But I do feel that writing has allowed me to be much more empathetic, much more curious, much more observant, to just go beneath that initial sort of layer and to really dig deep and really get to the essence of, what this is about and connect the dots and think about what do things in the moment mean in the continuum of space and time. And I think that type of perspective can sometimes help me understand things, can help me cope. Sometimes they help me be a better teacher. It always helps to have an interesting historical tidbit about ACE inhibitors on rounds to get people paying attention. So, but I think the main thing that my writing has done is that it's just made me a more curious and observant person as a physician.
Yeah, that's excellent. I think that's a great note to end on. I now also have a nice historical tidbit for ACE backgrounds, but I can't wait to share that, which is a great story. But again, Dr. Warraich, I just want to thank you so much for spending the time here with us and sharing your wisdom with the cardio nerds. We can't say enough about how thankful we are and how much we enjoyed reading the book. It truly has been a pleasure.
Thank you, everyone. It's great to see you. I love the conversation, and please feel free to reach out.